Dangerous place for a young, pretty girl. You know, I really didn't have a sense of self then. I really knew nothing about what it was like to become a young woman. And I had a lot of attention from these guys, a lot of male attention. And it really got me in a lot of trouble. I became sexually active at a very young age, which was really an awful thing for me because I had low self-esteem anyway. When I had 6 weeks sober, my father died, and he died of a heart attack. When I was a teenager, we used to fight like animals because he felt so powerless, not knowing what to do with a young girl who was acting out the way I was and depressed the way I was. And I felt very guilty when he died. I felt that I had killed him. You know, staying clean and sober is essential for a person who's an addict. The process of recovery has really been about uncovering all those feelings that I buried, getting to really know myself and to know my genuine self, who I really am, and to be able to, without fear, present that self to the people that I meet.
Green lights and blue skies are on their way. Yeah, they're on their way.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Corey. Happy birthday to you.
Thank you so much.
That was the New York version.
It was a very good version. I timed it. It was 8 seconds. Not even going to run over on your time.
So give a blow.
Oh, yeah. I'll give a blow. My birthday wish is that we have people watching this interview and that somebody, one person, hears something that changes their life, that puts them on a path, the path that I celebrated this week, my sober anniversary, my sober birthday of 8 years. And I hope somebody else is able to pick up their own white chip, their own coin, their own initiation to starting to get sober, and that people who are either looking to get reset or continue what they're already doing, get some benefit, some help from what Irene and I are doing on the podcast. So now I'm going to give it a blow.
Give it a blow.
Okay, now? Okay, they tell me now. I still have the wind.
Excellent.
I still have the wind.
Happy birthday.
Thank you. I'm really excited to be here today because on my birthday, we have a very special guest for our podcast today. You're on Crosstalk. You're watching Crosstalk, the #1 recovery podcast on the face of the earth. We've actually taken a poll, and the results were just in just before we started taping this. This is the best podcast if you want to find out how you stay sober, how you get sober, and how to live happy. I want you to follow us. I want you to subscribe and smack the shit out of that like button, because that tells us that we're doing the right thing. And if you have comments, give us your comments. Tell us what you like, what you didn't like. Tell us things that you want us to do for you, do more of on Crosstalk. I'm very excited to introduce my guest today. My guest is my dear friend, somebody who I am absolutely in love with, who is in recovery, long-term recovery. She'll tell you all about her story. But Amy, thank you. Welcome. And thank you so much for being here.
Thank you for having me.
It's really great. So what we usually do is we do exactly what we're not allowed to do in those other meetings, which is what we just go back and forth and say whatever the hell might be on our mind.
Okay.
But tell us a little bit of how things started out in Amy's life.
Okay. I am a transplant from New York. I have been in recovery a very long time. I've been clean and sober for it'll be 43 years in May.
Wow, congratulations.
Thank you.
And when you say you're a transplant, you're a transplant to and from someplace.
I was born and raised in New York, and I live in Florida now. I came here just for a winter vacation and fell in love with the area, and have been here for the last 6 years now.
So for people that don't know, we're taping in South Florida.
Right.
We're on location with Amy.
That's right.
So you've been here how many years?
I've been here 6 years.
Very good. And so what's it like being like little baby Amy growing up in New York?
I could share with you my experience of coming from. I came from a lower middle class family. My father was a cab driver. He had many stories to tell about people who came into his cab. My mother was a homemaker. I was born in 1959, and I had two older sisters, much older. I had a sister who was 10 years older than me and one who was 14 years older than me. This was my mom's second marriage.
So your sisters were like Woodstock people.
They were, and the truth is, by the time I was 9 years old, both sisters were out of the house. One moved to Florida. She was 18 years old and left and moved to Florida. And the other sister had gotten married early. So I always kind of felt like an only child. And I went to school in the neighborhood. I always did exceedingly well in school. I was like this perfect student. In those days, they used to call it IGC, intellectually gifted children. And so we were on a track with the same kids. And, I hear a common thread with people who are in recovery about never feeling a part of, feeling that they were different. And interestingly, when I was growing up, I fit in very well with these little girls. But by the time I was like 12 or 13, I really no longer wanted to hang out with them. I guess hormones were kicking in, and I really wanted to be around boys. And when I went to middle school, I quickly transitioned into a whole different lifestyle, and I really was not ready for it. I started hanging out with a group of kids where I was the youngest. I was with some girls my age and others older, and they drank and smoked pot and hung out until late. I mean, I didn't even...
So you were in 7th grade and you're
I was in
hanging out
7th
with
grade.
10th, 11th, 12th graders?
Yeah, I was hanging out. The girls were anywhere from my age to 16, 17, and the boys, most of them, were 16 to 20.
Wow.
So they were much older than me. I mean, at that age, 13, 14 years old, I mean, you're just such a kid. But, I always wanted things before I was ready for them. I was attracted to things that I knew nothing about. And so I got involved with this, as you used to call years ago, a fast crowd. And, the first night I remember my mother telling me that I had to be home early, and she wanted me home at like 9 o'clock. And that's when things started to get going. And I remember within short order, within like a week or so, just starting to do what I wanted. I started coming home real late. And at this point, most of the girls would go home and I hung out with the guys. And that was a really dangerous place for a young, pretty girl, And I really didn't have a sense of self then. I really knew nothing about what it was like to become a young woman. And I had a lot of attention from these guys, a lot of male attention. And it really got me in a lot of trouble. I became sexually active at a very young age, which was really an awful thing for me because I had low self-esteem anyway. And I mean, these guys, I wasn't going to be anybody's girlfriend. They were so much older than me. So pretty much I was used, and it felt terrible. And I wanted to fit in, so I acted like I was older. And I remember we took it from the street corner into the bar. And I wasn't even old enough to drink. And I had phony ID that said, in New York at the time, you had to be 18 years old. And I had phony ID saying I was 18 years old and I was drinking and hanging out. And when I was around 16 years old, I started suffering from a clinical depression. And it was awful. And it came upon me like out of nowhere, where I felt really paralyzed by it. And, I was still doing well in school, and all of a sudden I could barely show up. And because my grades were so good, I was able to get like a medical excuse. And I spent, I guess, from age 17 to 18 in my senior year, I never went to school. And they just carried my grades forward as if I had been there. But I remember that clinical depression, really feeling like I had done everything that there was to do at age 17, and nothing felt any good.
It's interesting because the early years you fit in. You didn't really have a inferiority feeling. You fit in. It was when you transitioned with the older kids, because it was probably more exciting. It was new. You were young. You wanted to experience different things. That's kind of was. Do you have any kind of thought that is a little bit kind of like addiction related type of thing, to the excitement of the new stuff, or is it just where you were at the time?
Well, I think it was the excitement of the new stuff. But it was that type of recurring thing of always wanting to be older. My mother was 40 when she had me. And I remember as a kid, going to school with those kids, but I remember really hanging out with adults a lot throughout my childhood. I really was like an old head, so I was a very mature kid, but nonetheless, I was a baby. I was a kid. Right. And I knew nothing and should have known nothing about that lifestyle because I really wasn't ready for it. And even if I had been ready for it, what a lot of these people were doing was definitely not going to be a self-esteem building thing for a young girl.
Right. That's the key. That their behaviors were the kind of thing that would lead you to feel like you're less than.
Right.
Yeah.
And I think by the time I was 17 and clinically depressed, I started seeing a psychiatrist. My parents brought me to a doctor because they were beyond themselves. They really didn't know what to do. And they put me on medication. And in those days, the medication for depression was terrible. It never worked. All it did was make you physically sick. But I also started seeing a therapist. And this therapist, I remember him, Dr. Grimaldi. And he was a wonderful guy. And he was the first guy who really talked to me about my feelings. And he was very gentle and very kind. And through talking to him, I made the decision to move to Los Angeles from New York. I have a sister who lived there, the one who was 10 years older than I was. She moved from Florida to LA. And she told me that I could stay with her. And, that was in 12-step programs, we speak of geographics, where you take yourself somewhere and you think it's going to be different. That your whole life is going to change because you geographically move somewhere, but you take yourself with you. And I went out to LA and I stayed with my sister, and she lived right by the beach. And, that year that I spent in bed, I also got in touch with, since I was 13 or 14 years old, I realized that I had an eating disorder, that I used food the same way I used drugs and alcohol. I used it to fill up that emptiness, that hole that I had inside. So when I spent that year in bed, I gained some weight and I was still beautiful, but I felt overweight. And when I told my sister about that, she told me that she and her boyfriend used Black Beauties and Dexedrine to lose weight.
It's always good to have an older sister.
It's always good to have someone more mature to explain this to you. She also told me that they used Quaaludes, which was like the miracle drug for baby boomers to come down and to even out. So at a young age, I really had nobody watching me because after being with my sister for about a month or so, she lived with her boyfriend. She told me it was kind of time to move on. So I got a job. First, I went to the American Bartenders School because she told me she had a friend who didn't know what they wanted to do for a living, and that's what they did. So that sounded perfect. So here I was 18 years old. I wasn't even old enough to drink in California, and I was serving booze behind the bar. And I would speed during the day on Beauties and Dexedrine. And I didn't drink during my shift. I worked in an old man's bar. And at the end of the shift, the guys would back me up with drinks. I'd drink a little bit, and then I'd say, bye, guys. I'd go home, I'd take a shower, and I'd go out to the local bars, and that's where things really took off. And in those days, people were doing lots of cocaine, and they were also doing what was called freebasing cocaine. And my life got more and more insane. It was during that period I had my first real boyfriend. I was 18 years old. I met this guy. He was a few years older than I was, and I moved in with him, or I spent most of my time living with him. And he had a prescription for Quaaludes because he complained about some neck pain.
It's horrible. The
It was
neck.
horrible, the neck.
Yeah.
And we used to get 60 for $8. And he used to want to sell them, and I was completely against that. And so I used to speed during the day and do the lewds at night. And then sometimes I'd go out to the bars and drink. And I wound up in really dangerous situations. I wound up hitchhiking by myself, really things that, to tell you the truth, it's a miracle that I didn't get killed back then. I remember leaving someone's house and I couldn't find my handbag. And I went downstairs and I hitchhiked, and I was picked up by a group of guys in the car. And I don't know how I got out of there alive, but I got out. And, these types of things, I knew they were not the safest things, but they really didn't keep me from doing things like that over and over again. And, I was a bright girl, but I just, I was attracted to things that were just not good for me. And I was way too young to make healthy decisions.
And other than the therapist, Grimaldi?
Grimaldi, yeah.
Other than Grimaldi, nobody was really giving you any direction.
No guidance. And I was kind of, I used to go out to the bars by myself, which was insane. And so a really vicious cycle started. And I went back and forth from LA to New York a few times, again, another geographic, thinking that if I went somewhere else, my life would be better. And while I was in New York, I spent maybe about a year there, and I was working at a bar in the Village. And my roommate was the doorman, and he told me that he had heard of a 12-step program that could help with overeating, because both of us were always looking to be super thin. And he said to me, he was the first person that ever told me about my drinking. He said, and maybe it'll help you with the drinking and drugging a little. And, at that point in my life, I was starting to have blackouts. I used to, I used to feel a lot of tension, a lot of stress, and I used to get headaches. And I had a doctor give me Fiorinol, and I used to drink and take Fiorinol. And I remember having blackouts and brownouts, and not, waking up in places or coming to, and people calling me, and I had no clue who they were. And it was starting to get scary. And I went to this program, Overeaters Anonymous, and it was there that they addressed the food issue, but they also said that in order to really get in touch with the feelings that were underneath my behavior, it was important that I didn't drink or use drugs. And hearing that was not what I wanted to hear. And so I upped and ran again and moved back to LA. And it was there that I went to my first AA meeting. And it wasn't because I believed I had a problem with alcohol. I just believed that I was a compulsive person, and I just needed to learn some balance. And I went to this meeting, and I remember, the thing that blows me away about 12-step programs is the love and the support, the nurturing. And this was something that I'd wanted all my life. This is what I was looking for in all the guys that I had slept with when I was 14 years old, was somebody to be loving and caring and to see me. And I walked into the meeting, and it was in someone's house. And there were about 20 people there, and many of them were in their 20s, and they were laughing and joking around and talking. And people hugged me and they welcomed me. And then when the meeting started, people started talking about their feelings. And they talked about things that I felt, things that I had identified with, and they talked about things that I had done. And I felt really comfortable there. And they talked about going to a meeting every day, and I had never heard of that. It went in one ear and out the other because I wasn't ready for that. But I liked what I heard. I liked the way I felt there, you know? And so I started going to meetings, and you only went once a week, and I still went to the bars on the weekend.
By the way, you're in around early 20s, mid 20s at this
I got
point?
sober when I was 22.
Okay.
So this was probably between 20 and 22.
Okay.
And I would go to the bar. Actually, it was closer to 22 because I would stay sober during the week, and on the weekends it was a 50-50 chance whether or not I would drink. And I'd go back to the meetings, and people would tell me that they love me and that I should keep coming back. And people really cared. When I had 6 weeks sober, my father died, and he died of a heart attack. And when I was a teenager, we used to fight like animals because he felt so powerless, not knowing what to do with a young girl who was acting out the way I was and depressed the way I was. And I felt very guilty when he died. I felt that I had killed him. My mother used to tell me when we fought that I was going to give him a heart attack. And when he died of a heart attack, I just wanted to die. And at that point, I had 6 weeks of sobriety, but I wasn't going to a lot of meetings. And I went into a halfway house because I was afraid. I was afraid of drinking, but I was also afraid of wanting to hurt myself because all the stuff that came up was too overwhelming. And it was in that halfway house that I really learned about recovery. In most 12-step programs, you get a sponsor who is someone to help guide you through the program. Most of the programs believe that it's important to have a higher power. And that was something that was very different for me because I was raised in a Jewish family where we didn't really talk about God. And my family was not very religious. And so it was very foreign for me. And when my father died, that's when I really threw myself into the program in this halfway house.
It's really interesting because I think you're the first interview we've done where something traumatic like that kicked you in the right direction. Because so often, the traumatic events go exactly the other way. It's really interesting. And you're so young at the time. So I guess all the things that you did, putting one thing on top of the other, somehow you were ready at that point. But it's interesting at such a young age with that trauma happening that you said, hey, I got to go all in on this. Really, you ever think of that?
What's kind of funny is, 12-step programs talk about being spiritual programs. And over the years, I've always had trouble with the God concept. Yet I do believe over the years of my sobriety that there was a power greater than me that has led me throughout my life. And when my father had died, I was not healthy enough to know that I needed the program. Something kept me there, and something opened my heart enough so that I could finally hear what people were saying, and that I became ready to ask for help. So ironically, I don't think it was my brilliance. I think it really was the universe leading me on the path that was meant for me. And what I could tell you is, all the things that I've been throughout my life. I mean, just because you get sober doesn't mean that life gets easy. Life is still life. And all the challenges that I've had to deal with, many of them were really difficult. And I'll share with you about some of those things because I think, staying clean and sober is essential for a person who's an addict. And to stay sober during difficult times is the most challenging, but that's when the biggest lessons in life have come for me. And, many things happened. I went to college because I had never gone to college before sobriety. I was very smart but intimidated by being compared to other people. And I went to undergraduate school. I became a realtor. And then I stopped enjoying real estate and I went to graduate school. I went to Columbia University and got a master's in social work. And, amazingly, at my graduation, Katharine Hepburn was the honorary speaker. And I remember being on the grounds at the quad of Columbia University, and with the columns and everything, it's a historic setting. I remember waiting in line for the procession to go in and starting to cry because I was just so overwhelmed. It was 1991. I had 10 years sober. And I was going on to a profession that I had always wanted, but I never thought, I wasn't willing to pay the dues. I wasn't willing to go to school and to do what needed to be done to get the training and the license necessary to do this.
It's interesting. The first 22 years, if there's one thing that you were deficient at by your own story, is that feelings were absent. It was all about whatever, the next, exciting thing was. But you're in a profession and you do an amazing job in your profession providing therapy to patients where that's really all your life is about. I told a story right before we started this interview, is that when you and I know each other from a recovery group, and when you speak, for me, that's one of the highlights of my week, because you always say things that connect feelings, and you say things that make everybody uncomfortable because no one goes there. No one wants to go to the underlying things that really are causing us stress, causing us difficulty. You're really good at doing that. I'm glad you went to Columbia. I think it really is you, not Columbia, but it really is an incredible talent you have to connect with your own feelings and to connect with other people. So you're tearing up, not because of Katharine Hepburn. You're tearing up because here you are graduating, 10 years sober, and so what happened at that point?
Well, it's interesting. You made a comment about not having the feelings when I was younger. I had a lot of feelings when I was younger. I had way too many feelings, and I didn't know what to do with them. And so I used drinking, drugging, food, men, things to push down the feelings because I was so uncomfortable in my own skin. And when I was in Columbia and I was doing all this learning and training about working through feelings, I'm going to backtrack a minute. When I was in high school, they had us do some community service. And they took us over to Creedmoor, which was state hospital for the criminally insane. And they had a hospital for children. And they took us into that hospital and we were supposed to volunteer there. And some of the most meaningful thing I ever did in my whole life started there is they hooked me up with a kid named Jesus Velez. Jesus was 16 and I was 16. But he had a lot of mental difficulties. I believe he was retarded. He probably had autism. He had a lot of things. And he had been abused as a child. His mother had 9 children, 6 of which were in mental institutions. And my volunteer job was to visit him once a week and bring him lunch and take him walking out on their campus and to be his friend. I have to tell you, that relationship was one of the most meaningful in my whole life. And that was what paved the road for me wanting to be a therapist, is the feeling that I got in being able to give of myself and seeing how much it meant to somebody else, and that my kindness could help another person heal. it was life-changing for me. You know, they used to tell him he used to pull the fire alarm at the hospital. And they'd say to him, if you pull that fire alarm, we're not going to let Amy come. And he'd say, I'm sorry. Because he loved me so much, he couldn't wait for me to get there, you know. But it was beautiful to be able to get my license and to start my work. And that's what I do today is I do therapy, and I've had tons of my own therapy. And the process of recovery has really been about uncovering all those feelings that I buried and getting to really know myself and to know my genuine self, who I really am, and to be able to, without fear, present that self to the people that I meet. I think people, alcoholics and addicts, tend to be very lonely people. And I think that the loneliness is from lack of human connection. And connection is not about having people around you. Connection is about having an open enough heart to be able to touch each other and to be able to identify with each other. And if you're not in touch with your own feelings, it's impossible to be able to be patient enough to listen to somebody else, to hear them, and to identify and share. So the process of recovery has been a process for me of uncovering, discovering what my feelings were, looking at some of the early lessons I had in my life. I mean, my parents did the best that they could with what they had. I was a parent, I was a sober parent, and now I'm a grandparent, and that's a very hard job. I mean, there's no schools. You don't get a master's degree in being a parent, and it was extremely challenging for me. So I don't blame my parents. I think they did the best that they could, but I think, you know, for a lot of kids, we grow up in our families and we take on all the stuff that was passed on to them through the generations. We have our own personalities. We have our own deficiencies. And out of shame, we all keep a lot of that to ourselves because we're afraid, God forbid, somebody should see that we're not perfect. That was a very big thing for me, was to accept my humanity and to realize that I'm not perfect and neither is anyone else. And to let go of some of that and to just let who I am come out. So I really see that as my journey today, is to just be the most genuine that I could be. And to, you know, I think that pain and suffering that we all go through in life to get through difficult things would be so wasted if we couldn't express it and help each other with it. So I really think that that's the purpose. The purpose is for me to be very candid about what I've been through so that you can connect with me and we can learn from each other.
I think what came out of, you didn't use the word, but the overriding thought I had in my mind is that what allows one to connect and really matter to somebody else is having a kind heart.
Totally.
You know, that's the way you connect. If you really care about somebody else, they know it. You can't bullshit that. You're either in it and you really give a shit, or you're just like talking the talk. And to connect with somebody else, to go that extra mile, to be able to reach out and touch somebody in a way that's not superficial, that gets to what's going on with them. And I think the only way you do that is what you just described, is to be transparent in your own life, to say, hey, you know, this is me. Right. And if you don't like it, I can live with it. And if you want to make a left or a right or, you know, a U-turn, that's fine. But this is still me. And I'm going to be me. And I hope you love me. And I care about you. And that's that seems to be with alcoholism and active drug addiction. It's very isolating. It's hard to get to that. All we're trying to do is change how we feel. You called it stuffing down, like, you know, pushing down the feelings. I refer to it as changing how we feel, because whether it's food or it's gambling or it's any of the isms. It's all about changing because you're not happy with how you
Right.
feel. So you put it down. What they said in OA, it's kind of reminded me when they said probably that thing about not drinking
Right.
and not drugging is important in order for you to be able to have an idea of what the hell you're doing with food. It's the same thing that when you go to a rehab, the first thing they do is you detox
Mm-hmm.
because you have to get it, you're physically, you got to get that stuff out of your system to be able to think coherently. Anyway, I don't know where I'm going with that,
Yeah.
other than the fact that, the alcoholism separates us from one another,
Mm-hmm.
and it isolates us. And, in this recovery thing, we're able to do what we're doing here right now, which is to connect with one another.
Mm-hmm.
So talk a little bit about, what your recovery has looked like. You've been in recovery for so long.
Mm-hmm.
Has it been like a constant thing from, an early age for over 40 years, or have you gone through different iterations of ups and downs? I'm sure, life has thrown you curveballs here and there like all of us.
Mm-hmm. Well, first of all, I wanted to respond to what you said about kindness. I mean, kindness is everything. And addiction is very selfish. Addiction is about feeding the self, and it's not a moral thing. It's a hunger. It's an addiction. And when you remove all the substances and you have a human being, connection is a learned response. You have to learn how to connect. And you have to learn how, what they say in a lot of 12-step programs is, don't compare your insides with someone else's outsides, And so I had to learn I think in the program we're very, very blessed because we have the opportunity to hear people's experience, to watch them go through different life situations and not pick up a drink or a drug over it, and to share how they felt and how they got through it. And what that's done for me is I know I'm from the No Matter What Club. I'm a member of that club. I know that no matter what, just for today, I'm not going to pick up a drink or a drug. And, they used to say in the rooms years ago that if your ass falls off, you don't pick up a drink or a drug, you put it in a paper bag and you take it with you to a meeting, And I've gone through many things in my sobriety. And again, there were some of those that I'm not so sure it was me that kept me from picking up. I remember one of the first huge things I went through is I met someone in the program. We both had 1.5 years of sobriety.
3 years total.
Right. And we 3 years between us, and we dated for 7 years, and then we got married. And when we wanted to have a family, I graduated Columbia, and my plan, because, I'm full of plans, and they say, you make plans and God laughs. My plan was to graduate, get pregnant, be a stay-at-home mom for a couple of years, and then work in the field. And I got pregnant immediately, but I had an ectopic pregnancy, and then I went through 5 years of infertility. And I remember being so angry. I couldn't understand why, as a little girl, I had played with dolls. I always wanted to be a mommy. And I couldn't imagine why that couldn't happen for me. And I was very angry and depressed. And you're also put on a lot of hormones if you do infertility treatment. And it was just such a terrible time in my life. And I got through that, and I didn't drink and drug. And I wound up adopting 2 beautiful babies that are 3 weeks apart in age, and those babies are now 27 years old. But when they were 3 years old, my ex-husband, my first husband, did not want to be married anymore. And he had an affair and left and told me that after 10 years of being together, he no longer loved me. And here I was with this family that I killed myself to have, alone with them. And that was such a challenging period in my life. And he gave us child support for the first 7 years, and then he stopped. And I started working both in real estate and as a therapist. to support my kids. And I put braces on their teeth and did everything that I possibly could. But those were very tough years. And the thing that kept me going was going to meetings and having a support network of sober people that I could be honest with and tell them exactly how I was feeling and to get support. Because, this life is not the type of thing that's really meant to be lived alone. It's not possible. Too many challenges come our way. So I made it through raising 2 kids, and I was with someone for 10 years who had brain cancer, and we lived through that. And he passed away, and I got to take care of him for those years. And I learned incredible life lessons through that. And no matter what I've gone through, and my children were very difficult kids growing up, it was not necessary to pick up a drug or alcohol. And the only reason it wasn't necessary is because I stayed real close to recovery. And I know that today. And I'm very grateful because, when you go to meetings, what you hear is you get to see the people who stop going to meetings and who relapse. And, we believe that it's an ongoing disorder, that even though I'm in recovery all of these years, if I, God forbid, pick up a drink or a drug, I'm going to be off to the races again. And it may not happen right away. It could take weeks, it could take months. But if I truly am an addict, all hell's going to break loose again. And all these great life lessons I've learned, I won't be able to access them anymore because I go back into the illness.
Yeah, a couple of thoughts. One is I've heard the expression, there's no problem that can become a stress point in my life that doing a drink or a drug can't make worse.
Right.
And the other thing is after a long period of sobriety, I decided that maybe I had changed and I could do it again. And let me tell you, it was exactly the same thing. So I'm proud of my 8-year coin, which I got this past week at my home group. But I know exactly, and I said this on Saturday, I know how the movie ends now. Mm-hmm. I know it's not going to be any different. And 8 years ago, I joined what's the name of the group?
The No Matter What Club.
The No Matter What Club. I like that.
Mm-hmm.
Yeah, I have yet another club that I'm in now. But
I'm not sure you can talk about that in public, but
yeah, I could talk about anything. If they don't like it, let them walk away.
Right.
Something you said was really interesting, and it triggered a thought of mine. You said we compare our insides with people's outsides. Mm-hmm. Often, talking to people who are having some trouble, I'll say the proper way to compare is not to compare yourself with other people because you're comparing your insides with their outsides. But a really good comparison is to compare yourself with yourself. How did you feel when you started this journey? Mm-hmm. The first day you decided you were going to make a change. How do you feel now? Mm-hmm. Everybody, even if it's 3 weeks or a month or whatever period of time, everybody always feels better. Mm-hmm. Doesn't mean life, the person didn't die that was sick or, stuff happens, but you never feel worse by stopping that behavior. You always feel better. That's a fair comparison, comparing yourself then and now. And it gives you the impetus to continue, to not go back, because we know what that's going to look like. It's repeating the same behavior. I'm not even, the quote,
Insanity is repeating the same thing over and over again and expecting different results.
I said not to do that.
Well, I don't listen.
So I have to tell you, I could listen to you talk all day long, and I really don't want to do more talking. What is it that you'd like to share? Just general, anything that you think would be interesting for our listeners to hear about in terms of things that you've discovered, maybe things that you've discovered with people that you've shared recovery with, or patients, or whatever. Obviously, just your own experience.
Well, I guess, a couple of things come to mind. One is the importance of never giving up. because I've seen people give up. I've seen people get really scared and isolate again. And when you isolate, all you have is your own worst thinking going around in your mind, and most people will drink or use again. And so not giving up, realizing that this is just a moment in time. You know, it will pass. Everything passes. The horrible things pass, the good things pass. When I was newer in the program, there was a guy named Sam in New York, and he always used to say to me, the best is yet to come. And I believe Sam, and that gave me so much hope. But when infertility hit, I remember thinking, Sam was full of shit. The best is not yet to come. This isn't fair. You know, I expected everything to be fair, and, you know, life isn't fair. But life happens to all of us. We just don't see it happening, and it happens at different times for all of us. I remember hearing a country song that says, we're all reading the same book, we're just on different pages. You know, so things are going to happen, but I just can't be away from my pack. You know, I have to be in the middle of it so that there are people around me so we can help each other. I mean, I think that's the most essential thing. No matter how successful you become, however you define success, the important thing is a sense of community. Also, I think a very common thing that people struggle with is comparing themselves to others and having expectations that they think other people have of them and worrying about what everybody's thinking about them. Those things plagued me throughout my adolescence, my young adulthood, and through a good part of my life. And you know, it's interesting. I think that I'm the happiest I've ever been in my life. And I think the way I got here was the combination of years of sobriety and recovery and therapy and age, maturity. Because over time, what I've come to realize is that nobody's really looking. You know, people may glance at you and they may pass a judgment in their mind, but most people are pretty self-absorbed.
Right.
And they go right back to thinking about themselves. So it's an illusion that everybody's looking at me or thinking about me. So if that's the case, I have to really be true to myself and live my best life. You know, I had a lot of issues with my sexuality growing up. I'm bisexual, and I felt so weird about that because people don't really talk about that much. Yet people talk about being gay and being straight. And to be honest with you, being bisexual, it gets a real bad rap out there, and there's not a lot of support in either camp. And my journey as an adult has been finding comfort with that, finding what it means to me to have fluid sexuality. And who am I? And does it matter who I'm attracted to? And does it matter what other people really think about that?
No one's keeping score.
No one's looking. They're glancing, and then they're just back into their own life. But it's important for me to meet different people and to learn from their experience. And I'm not going to learn if I don't let them know who I am.
I read a book called Scary Close by Donald Miller. I think I talked about this on some crosstalk related reel or interview, but it reminds me that he talks about a palliative care nurse who had the care of 20,000 dying people over the course of her career. Mm. And when she was interviewed about her experience, she said, you know, people that were dying often had great things that they were proud of, the things that they were grateful for. But the common regret that the dying had is that they had lived their lives in a way that they thought other people wanted them to live, as opposed to the way they wanted to live their own lives. Mm-hmm. And the author then relates that he had written things that he hadn't published because he didn't think they would be received properly. Mm-hmm. Things that might have inspired people, might have been wonderful. And he then says, wouldn't it be a terrible thing on your deathbed, be surrounded by the people who loved you the most, and they have no idea who you are? You lived your life in the way, you don't even know if the way you lived your life is the way they wanted or they thought, because you never really went there because the feelings were too hard to go to, too difficult to deal with. So, I mean, it's so refreshing, to hear you talk so freely about yourself, both with respect to your recovery, sexuality, any issues, because you're here right now. And anybody who's watching this interview, they're probably watching it in a comfortable chair, but were they in a stadium, they'd be standing up and clapping, because that's the feeling I get listening to you speak. It's really so refreshing, inspiring to me. It allows me to do things like I've done. You and I have been in meetings and things that have shocked people, left and right. And we're in South Florida here. Not everybody loves to hear all this stuff.
Yeah.
But I don't care, that quote that I have on our website about, transparency can transform your life. Suit up, show up, and dare to be seen. Today, I want people to know who I am. And if they don't like what I do, whether it's with regard to who I sleep with or who my friends are or what kind of things that I do, there are some people that actually think I'm nuts for doing crosstalk. Somehow that's for the young kids. Well, yeah, it is, but it's also for whoever else wants to do it. And, I don't know. I think one of the things that's wonderful about being around people like Sergio, whose idea it was to do crosstalk, is that he throws ideas out that I would never have even thought of, which is why there are two cakes on the table, too.
Well, that's why we need other people.
Yep.
I mean, if you're a peach, you have to be the best peach that you could be. You can't be a peach trying to be a plum, because there's no way you're going to be a good plum, And if people love us and didn't really know us, then they didn't really love us, because they didn't know us for who we are. And, in my work today, I will use my own experience. I will be self-revealing only if I feel it can help the person. And so often it does, because people come in, they don't know what therapy is, and they come in hurting and so full of shame, and there's a bit of a power issue when you're the therapist. And if I could say, wait a minute, I've done that. I have felt that way, and it's okay. I'm still standing. I'm still here. Nothing terrible has happened to me. It's very powerful, and it gives people courage and hope.
So I have a question we ask our guests that we get some interesting answers. But I'm wondering if we go back to 12-year-old Amy. And I picked 12 because that was kind of like the inflection point of change, where you left the schoolgirls and you decided to take a look as you went into middle school to, a kind of a faster crowd, as you said. So if you had 12-year-old Amy in front of you today, what advice would you give her? What would you tell her in terms of what tomorrow looks like for her? What kind of things would you want her to know that you've learned?
That's a tough one. That's a very profound one. I've done therapy about 12-year-old Amy, and I've made a lot of progress. I used to be ashamed of her. I used to think that what's wrong with her, that no one wanted her to be their girlfriend, that she slept with people when all she really wanted to do was to be hugged and held and cared about. And what I would like to do, first of all, was put my arms around that 12-year-old, because inside that 12-year-old is the little girl that she always was. And just to let her know that it's okay. It's okay to feel like a little girl. It's okay to feel like you don't know what to do, that you don't know everything. It's okay to say you don't know. It's okay in the moment to not know what the next move is. and to just be open, and the answers will come. And I guess what I would say is to surround yourself with people that you admire and be who you are and learn from each other. You know, I remember reading a book in my early recovery called Everything I Needed to Learn, I Learned in Kindergarten. And basically what he talks about is, you know, holding hands while we cross the street and having cookies and milk and taking naps. You know, and in recovery, we talk about don't get too hungry, too angry, too lonely, or too tired. Halt. You know, learning how to stop when we have needs and learning how to get help to learn how to fulfill those needs. So I think that's very important. And, you know, everything comes in its own time. I remember earlier in my recovery feeling resentful because I never really met the love of my life. And I did struggle with loneliness for a long time. And now I'm in an incredible relationship. I've been with the same man now for 4 years, and we're very much in love. And we're really good to each other and kind to each other. And we're a team and we help each other. And I would never have imagined that I could have that type of quality, healthy relationship. You know, and had I met this guy 20 years ago, we probably wouldn't have even liked each other because we weren't ready for each other then. That, you know, things don't come a minute too soon. They come exactly when they're supposed to come. And you can only put one foot in front of the other. You have to look down and see where your feet are and begin where you are, putting one foot in front of the other. And what's supposed to come to us will come. That's really about all of it.
That's a great way to put a exclamation point on our interview. I really appreciate you being here. I know that our producer is going to want to do some reels with you. That is to say, he's always got ideas that I don't have. So first off, the way we end these interviews, and it's something that I think is selfish of me, but I always want to hug my guests.
I love hugs.
It's a good way to end, right?
It's the best way.
Here, and give me a hug.
Do I get to hug Sergio afterwards?
Yeah.
Because he's adorable.
Yeah, whatever. You can do that.
Hugging is good. Belly to belly.
What's that, belly to belly?
Belly to belly.
Yeah, but there's a John.
Oh,